looking at emerging data for the next 2-week period, which is June 20th to June 3rd, which of course is incredibly preliminary, that early data is pointing to another substantial increase, likely more than double the 15% we saw in June. Now, as we move forward, knowing that about the variant and how we sequence, I want to summarize 3 key things that I think we all need to know about the Delta variant as it's moving in to the state of Ohio. First, Delta is highly contagious, and it spreads exponentially fast almost anywhere it has gone. Estimates are that it's about 50% more contagious than Alpha, or the B.1.1.7 so-called UK variant, which itself was 50% more contagious than the variant which caused our winter surge. As a result, the Delta variant is moving rapidly to replace B.1.1.7 or the Alpha variant as our dominant form of COVID-19. Secondly, Delta is a real threat to the unvaccinated, or those who are not yet fully vaccinated. According to the CDC, current data suggests that 99.5% of COVID-19 in the United States has occurred among unvaccinated people. And experience in the UK also suggests that those who are younger than 50 may now be more than twice as likely to be infected. And this actually makes a lot of sense when you consider the very high vaccination rates among those older than 50 that are present both in the UK and here in Ohio. And according to a recent Lancet study, Delta is much more likely to cause someone to be hospitalized if they're unvaccinated than the Alpha variant was. So the reality is we now have 2 Ohio's, an Ohio that is vaccinated and protected on the one hand, and an Ohio that is unvaccinated and vulnerable to Delta on the other. Looking at places like Missouri, which have been dealing with high rates of the Delta variant, it appears that communities with low vaccination rates are at particular risk of what have been called hyperlocal outbreaks, concentrating the devastating impact of this disease in those communities. And lastly, vaccination remains our best defense, and in fact offers excellent protection. All 3 of the vaccines offer very high rates of protection against Delta hospitalization and death. And while yes, there are potential side effects from vaccination, just like there are from any antibiotic or any medication, those risks are small indeed compared with the risks of COVID-19 for people of any age.